Welcome to our channel. If you're struggling with medical bills, follow these step-by-step instructions to get financial assistance and reduce your healthcare debt. Step 1. Contact the hospital or provider's billing department immediately. Explain your financial situation and ask about financial assistance programs, charity care, or payment plan options. Step 2. Apply for the hospital's financial assistance or charity care program. Nonprofit hospitals are required to offer these programs and may forgive or reduce bills for qualifying patients. Step 3. Request an itemized bill and review it carefully for errors. Medical billing mistakes are extremely common, and you may find duplicate charges or services you never received. Step 4. Negotiate your medical bill directly with providers. Ask for self-pay discounts, which can reduce charges by 30 to 70%, and request removal of facility fees or other inflated costs. Step 5. Set up an interest-free or low-interest payment plan. Most providers prefer receiving payments over time rather than pursuing collections, so arrange affordable monthly installments. Step 6. Apply for Medicaid if you haven't already. Some states allow retroactive Medicaid coverage that can pay for recent medical expenses if you qualify. Step 7. Explore nonprofit organizations that help with medical debt. Groups like Healthwell Foundation, Patient Advocate Foundation, and disease-specific charities offer grants for medical expenses. Step 8. Consider medical credit cards or personal loans as a last resort. Options like Care Credit offer promotional interest-free periods, but read terms carefully to avoid high interest charges. Don't forget to like this video and subscribe to our channel.